all, welcome to the sports performance analysis for Cricket T20. Cricket T20, also known as 2020, is a shorter and more dynamic format of cricket characterized by fast paced action and high scoring contest. Introduced to provide an entertaining and time efficient version of the game, T20 has gained immense popularity globally. Cricket involves various motions, include sprinting between wickets, bowling with explosive action, batting with quick reflex and dynamic movements, quick fielding and throwing. Physical demands explosive power for batting and bowling, speed and agility for running between wickets and fielding, endurance for prolonged matches, quick reflexes and high hand-eye coordination for batting and wicket keeping. Physiological demands for cricket T20s are elevated heart rate and oxygen consumption during sprints, high intensity bursts of activity, anaerobic metabolism during explosive actions like bowling and batting. Normative data for cricket T20s batting average typically range from 20 to 40 runs per inning. Bowling average varies based on the player's role, but top bowlers maintain average below 20. Strike rates batting strike rates range from 120 to 150. Bowling economy rates aim for values below 8 runs per over. Common limitations are risk of injuries due to explosive action, fatigue in prolonged matches impacting performance, weather conditions affecting play, pressure and mental fatigue influencing decision making. Test and assessments for Cricket T20. So, first test is single leg stance with eye closed for Cricket T20 player. The single leg stance with eye closed test is designed to assess the dynamic balance and proprioception of cricket T20 players. This test is crucial for evaluating a player's ability to maintain stability on one leg, which is essential for actions like batting, fielding, and quick change of direction during the game. Used flat surface. The assessment is typically performed on a flat and stable surface, such as a gym floor or cricket field. Stopwatch to measure the duration the player can maintain the single leg stance. Marker or cone placed in front of the player as a reference point for foot placement. Procedure for these tests are: first is setup. The player stands on one leg with the non supporting foot lifted slightly off the ground. The hand can be placed on the hips or crossed over the chest. A marker or cone is placed about 1 meter in front of the player. Second is eye closed. Once in position, the player closed their eyes. Closing the eyes challenge the proprioceptive system as visual input is eliminated. Third is balance maintenance. The player aims to maintain the single leg stance for a predetermined duration, like 30 seconds. The duration is recorded using a stopwatch, and repetition. The test can be repeated on the opposite leg also. Assessment rationale. First is dynamic balance. Cricket T20 involves dynamic movements like running between wickets and quick changes in fielding position. This test assesses the player's ability to maintain balance dynamically on one leg, mimicking the demands of the sport. Second is proprioception. Closing the eyes removes visual input, relying solely on proprioceptions, the body's sense of its position in space. This is crucial in cricket, where players often need to react to the ball or change of direction without visual cues. Third is specificity to cricket T20. So, fielding, maintaining balance when quick changing direction for fielding. Batting, stability during shots, especially on one leg during lofted shots. Running, stability during quick sprints and change in direction between wickets. Organization and tailoring. First is time and frequency. The test can be integrated into regular training sessions. Perform it before or after other cricket specific drills. Repeat periodically to track improvements or identify potential areas of concern. Second is incorporation into training. Exercise targeting balance and stability can be included in the training regimen based on the result. Tailoring training intervention to address any identified weakness in balance. Third is monitoring progress. Regularly reassess the single leg stance with eye closed to monitor improvements or changes in the player's dynamic balance and proprioception. Shoulder external rotation range of motion for cricket T20 players. Purpose of this test is the shoulder external rotation range of motion test is designed to assess the flexibility and mobility of the shoulder joint in cricket T20 players. This test is crucial for evaluating the range of motion, specifically in the external rotation of the shoulder, which is essential for bowling, throwing, and fielding actions in cricket. Equipments used for these tests are goniometer. A goniometer is a specialized instrument used to measure joint angles. It is essential for accurately quantifying the range of shoulder external rotation. Second is firm surface. The test is typically performed on a firm and stable surface such as treatment table or mat. Procedure for these tests are preparation. The player sits or stands in a comfortable and relaxed position. The examiner explains the test and the importance of full external rotation for cricket action. Initial positions: the player's elbow is flexed to 90 degrees. The examiner supports the player's upper arm to stabilize the shoulder. Third is goniometer placement. The stationary arm of the goniometer is aligned with the midline of the body. The moving arm is aligned with the midline of the forearm. External rotation: the player externally rotates the shoulder to the maximum extent possible without lifting the elbow or causing discomfort. The examiner notes the degree of external rotation indicates by the goniometer. Repetition: the test can be repeated on the opposite shoulder for a comprehensive assessment. Assessment rationale. First is bowling action. Full external rotation is crucial for generating power and precision in bowling actions, allowing the player to achieve the desired arm position during the delivery. Second is throwing accuracy. External rotation contributes to the accuracy and speed of throws, which is significant for fielding and returning the ball quickly to the wicket. Third is fielding maneuvers. Efficient external rotation aids in quick and accurate fielding movements, enabling players to cover ground and release the ball rapidly. Organization and tailoring. First is injury prevention. Identifying limitations in shoulder external rotation helps in preventing injuries related to overuse or improper biomechanics during cricket action. Second is individualized training. Based on the assessment results, player with limited external rotation can undergo targeted stretching and mobility exercise to improve shoulder flexibility. Third is integration into training routine. The test can be incorporated into regular training sessions, especially during pre-session assessments. Result can guide the design of warm-up routines and specific exercise to address any identified restrictions. Fourth is progress tracking. Periodic assessment can be conducted to track improvement and adjust training invention accordingly. Drop jump test for cricket T20 players. Purpose of this test is designed to assess the landing mechanics, power, and reactive strength of cricket T20 players. This test is crucial for evaluating how well players absorb and generate force during landing, which is essential for actions like batting, fielding, and fast changes in direction during the game. Equipment used: plyometric box or platform, a sturdy elevated surface like plyometric box or platform from which the players can drop. Measuring tape or vertical jump mat to measure the height of the jump, and marker or tape to mark the takeoff and landing positions. Stopwatch to measure the time of flights. Procedure for this test are preparation. The players stand on the top of the plyometric box or platform. The feet should be parallel and shoulder width apart. Starting position: the player starts in an upright position with the arms positioned comfortably. Third is drop phase. On the command, the player drops off the box, focusing on minimizing ground contact time. Fourth is jump phase. Immediately upon landing, the player performs a maximum vertical jump. The jump height is measured from the highest point reached. Fifth is landing technique. The player lands with a soft and controlled landing, minimizing excessive knee valgus and maintaining stability. And sixth is repetition. The test can be repeated for multiple trials and the best jump height is recorded. Assessment rationale: landing mechanism. Assessing how well players absorb force during the drop and control their landing is crucial for injury prevention and optimal performance. Power generation: the ability to transition quickly from the landing phase to an explosive jump reflects the player's reactive strength and power, which is valuable in cricket action like batting and fielding maneuvers. Efficient landing mechanics contribute to quick and controlled movement during fielding, allowing players to cover ground rapidly. Organization and tailoring. Injury risk assessment. The drop jump test helps identify any issue with landing mechanics that may increase the risk of lower limb injuries. Second is individualized training. Based on the assessment results, player with suboptimal landing mechanics can undergo specific exercise to improve technique and reduce injury risk. Third is integration into training routine. The test can be integrated into regular training sessions, especially during pre-session assessment or as part of a plyometric training program. Fourth is progress tracking. Periodic reassessment allowed coaches to track improvement in landing mechanics and power generation, guiding adjustments in training intervention. And fifth is performance optimization. By tailoring training programs based on the results, coaches can work on enhancing the player's explosive power, reactive strength, and overall athletic performance. Overhead medicine ball throws for cricket T20 players. Purpose of this test is designed to assess upper body power and throwing ability of cricket T20 players. This test is crucial for evaluating the explosive strength and conditions of upper body, which is essential for actions like throwing, fielding, and powerful batting shots. Equipment used: medicine ball, a weighted ball like 3 to 5 kgs, sustainable ball overhead training, flat surface, a flat and stable surface such as gym floor or cricket field. Third is measuring tape or distance marker. To measure the distance the medicine ball is thrown. And fourth is marker or tape to mark the starting point for consistent testing. Procedure for these tests are preparation. The player stands with feet shoulder width apart. The medicine ball is held with both hands overhead. Starting position: the player starts with the medicine ball positioned above the head. The feet are parallel and firmly planted on the ground. Throwing phase: on the command, the player explosively throws the medicine ball forward for maximum distance. The throw should involve the entire body, including a powerful leg drive and upper body rotation. Fourth is landing technique. After the throw, the player maintains balance and control. Excessive steps or movement post throw should be avoided. Fifth is measurement. The distance the medicine ball travels is measured from the starting point to the point where it first contact the ground. Repetition. The test can be repeated for multiple trials and the best throw distance is recorded. Assessment rationale: upper body power. The overhead medicine ball throws assess the explosive power of the upper body, which is crucial for powerful batting shots, throwing, and fielding. Second is throwing ability. This test mimics the throwing action involved in cricket, providing insights into a player's ability to generate force for accurate and forceful throws. Third is batting power. The coordinated and explosive movements involved in throw are transferable to the power generation during batting, especially for lofted softs. Organization and tailoring. Individualized training based on the